Welcome to the Wascana Rehabilitation Center Children's Program. This video will give you an introduction to our children's program and give you an idea what you and your child can expect when coming for your first visit. Children's program is located in Wascana Rehabilitation Center at 2180 23rd Avenue in Regina. The closest visitor parking lot is directly east of the main doors. If your child's appointments will take more than 2 hours, you will receive a green parking pass to hang on your rearview mirror. The pass allows you to park in one of the outpatient therapy spaces in the lot immediately to the west of the main entrance. Please check in at registration. Remember to bring your child's hospitalization card with you. When you are finished at registration, they will direct you to the children's program reception, and once checked in, you will go to the Rainbow waiting room. You'll be with your child throughout the assessment. We will be asking you questions about your child such as, what do they do well? What are you worried or concerned about? What help do you have? You may have questions for us. It is a good idea to write down your questions before you come. If you do not understand something we are saying, please ask us. Some questions might be easier for us to answer after the assessments. Some children come for many services, other children come for one service. We will send you a schedule of who you will meet with during your first visit and the time scheduled to start each session. If you are coming for more than one service, the medical social worker is usually the first team member you meet on your visit. Their focus is on how your child's developmental needs affect your family. The social worker may ask you questions such as, who is in your family? Who else helps with your child? What supports do you need? The medical social worker can give you information about resources and other services as required. They can provide emotional as well as practical support. Your next stop will be with a physical and occupational therapist. They usually do their assessments together. Their assessment is done through observation, play, and by asking your child to do age-specific tasks. The visit with the occupational therapist is about how your child does everyday jobs, such as using their hands or doing tasks such as eating, dressing, or playing. The occupational therapist might ask you questions such as, do you have concerns about how your child eats or drinks? Is your child easily upset by sensations such as touch, sound, light, or movement? Do you have concerns about how your child uses their hands for play? The occupational therapist might also talk about equipment that is available to help your child be more successful in doing everyday tasks. The occupational therapist works with you and your child to decide on the most important skills for your child to work on to be successful in their everyday jobs. The focus of the visit with a physical therapist is your child's large movement skills, such as how they sit, crawl, walk, run, or jump. Depending on your child's age, they may assess strength, balance, coordination, and flexibility. This will involve some hands-on examination as well as observation of your child moving and playing in the gym or playroom. The physical therapist might ask you questions such as, is your child able to move and play as you expect for their age? Do you have concerns about your child's posture or movement? What physical activities does your child do? The physical therapist will work with you to decide the most important skills to work on to help with your child's motor development. The focus of the visit with a speech-language pathologist is your child's communication skills.
Green frog, what do you see? I see
a purple cat!
Purple cat looking at me.
The speech-language pathologist may ask you questions such as, does your child follow directions? How does your child let you know what they want? Does your child use gestures or sounds, words or sentences? How does your child play and talk with other children? The speech-language pathologist will use toys and books to find out more about your child's communication skills. You can bring along your child's favorite toy or book if that will help him or her feel more comfortable. At the end of the visit, the SLP will talk with you about the next steps for you and your child. A psychologist may be part of the initial visit and will usually observe your child with one of the other therapies. The focus of the psychologist is your child's overall development, including learning, emotions, behavior, play, and social skills. The psychologist may ask you questions such as, do you have concerns with your child's learning? Do you have concerns about any aspect of your child's behavior? At the end of the visit, the psychologist will discuss the next steps needed to address your concerns and answer questions. There are other therapy services that are not usually part of the first visit to the children's program. You can visit our webpage to see what other services are available. After the morning assessments, there will be a break for lunch. If you choose to remain at the center, there is a cafeteria on the second floor. There are many places in the main concourse where you could sit to rest. We also have a picnic bench in our playground area. We will meet up with you after lunch in the waiting area by the boat. We now meet to go over the findings and write up a family service plan or a care plan. In the room are the people you met earlier, as well as a clinic nurse and in some cases a physician. You can invite other people involved with your child, for example, teacher, ESIP worker, child care provider. We all play a part to develop the best care plan for your child based on your concerns. Based on your concerns, we discuss what services we think will help your child and your family. We write down the plan so everyone has a record of what will be done and by whom. The plan provides names and phone numbers of the child's team. We will discuss future therapy appointments. We decide when the team will meet again to review progress and update the plan. If you decide your child does not require services at Children's Program, we discuss this as well. Thank you for taking this video tour. We look forward to meeting you and your child at the Children's Program.